Nursing realities. What are the things that you should know before becoming a nurse? Hey friends, welcome back to my channel, and let me spill some inspiration to my fellow nurses, students, and aspiring immigrants out there. And if you're new here, thanks for joining. And a little bit of background about me. I'm a nurse immigrant based here in New Jersey. And I'm currently juggling between telemetry nurse manager, and I have my side hustle. I'm teaching nursing students. So yes, I've been in the nursing field for more than 2 decades now, and let me tell you, it's been quite the ride. So the goal for this video, I'm going to share with you my experiences and things that I never thought I would be able to do. So 3 things that I'm going to share, and today I want to be real with you. First, nursing isn't at all a glamorous job. Contrary to what others may think, it takes a lot of strength, muscles, and brains to be able to sustain this kind of work. Unless you've seen a nurse working, trying to save lives while you're taking care of your grandma or a family member, and you collaborate with a nurse, exactly see what they do shift to shift, then you will be able to understand. It's not a glitz and glamour job. Let's say it can get messy. Think about blood, poops, urine, vomits, and all of those things. You name it, we've seen it, we've dealt with it. And trust me, the smells, it's not for the faint-hearted. But here's the thing, even if you start off with a weak stomach and stamina like I did, over time, you'll be able to toughen up real quick. Growing up, I'm so scared of blood and needles, and in nursing school, back then, in the Philippines, in our anatomy, we dissected frogs and worked in the lab in cadavers. It's really tough. But with the right mindset, with grit and perseverance, you will be able to conquer that. Second, being a nurse is a really demanding profession. Talk about working long hours and crazy shift and spending that time standing on your feet. And sometimes you missed your meal breaks just to help out your coworkers. And now, when you get ready for the real job, once you become a nurse, you become a hero in your family. And sometimes your grandma or your mom would ask you some medical concerns. They think you're a doctor because for them, you're a rock star. Yes, that's the silver lining. Nurses are rock stars. It's not just about putting a band-aid, giving Tylenol to our patients. It takes brains and smart and critical thinking to be able to make a difference and save lives. And seriously, we're among the most trusted professionals out there. Nursing has been ranked the most trusted profession in United States for an impressive 22 consecutive years. According to Gallup polls, in the latest 2023 polls last year, 78% of Americans rated nurses as having very high honesty and ethical standards. Nurses have consistently outranked other healthcare professionals. But the truth is, even though we are highly regarded with good ethical and professional standards, honestly, sometimes the worst is you don't even get the gratitude you truly deserve from patients, families, and even doctors. And I'm sharing this because I've experienced this multiple times, especially working as a nurse here. And on the good side, there's a lot of career opportunities. Nursing, for me, is like a buffet. You can sample a bit of everything. You can try pediatrics, adults, ER, and OR. No need to pigeonhole yourself in just one specialty. That's why clinical experience is very important in our nursing school, so you can see which path you're going to explore, experiment, find your niche of specialty that is aligned with your passion. And for me, I did cardiac specialty for many years now because of my personal experience. I love doing it. This is where my heart aligned into. Back then, after graduation, I also started in med-surg, telemetry, surgical ICU, open heart recovery room, both adults and pediatrics, and then cath lab for a short time. Now I'm doing leadership in management, and my latest venture here in America, I never thought I would love teaching. Maybe I would do that for another episode while I'm doing teaching. For now, I'm just sharing nursing realities and what you need to know before going into nursing. Now, let's talk about reality checks. Working in hospitals or nursing, there's pros and cons of both. I did work before in subacute rehab. In hospitals, we have more resources and regulated patient ratios. I remember when I was working in nursing home, I tried it for a couple of years. As my second job, I was assigned in a dementia unit with 20 to 25 patients, only me as the nurse and 2 nursing aide. It's really hard. I never thought here you get to take care of 25 or even 30 patients. So for aspiring immigrants coming here, it's not always rainbows and butterflies, but it's something that you will learn to navigate. And speaking of navigating, burnout and compassion fatigue are real. It's hard to see our patients suffer, but you have to find healthy ways to cope. Yes, they always say nurses are superheroes, but remember, superheroes need a breather sometimes. And number 3, reality, nursing has a lot of stress. Sometimes I thought of it as nurse equals stress, but it depends again on your stamina. You have to learn how to cope. Nursing, when you start your career, it's a roller coaster ride. Environments like ER and especially in telemetry where I work, it's a fast turnover of patients, and also some other fields. Taking care of patients in an acute care setting, every second counts. But hey, take a deep breath, prioritize, always ask for help, and tackle one thing at a time. You are not alone. Get help from your co-workers and utilize the resources that you have. And despite all the chaos, nursing is hands down the most rewarding profession out there. There's nothing like seeing a patient walk out of the hospital healthier and happier and knowing that you've been a part of their journey. So yes, I say this all the time, nursing may throw some curveballs your way, but it's all worth it. And if you're thinking of diving into this world of nursing and you want some tips about leadership in management specialty or clinical teaching, hit me up in the comments section. I'm here to spill the tea and answer any questions you've got. Nursing is the most rewarding jobs I have seen, and I'm doing it despite all the stress and struggles that I go through. I say this all the time. I could not see myself doing anything else. It's super rewarding and beyond blessed to be in this profession. Don't forget to drop your suggestions for future videos. Thanks for tuning in, and I love you all. Thank you for your support. Please like and subscribe, and I'll see you in the next video.